Could you please explain what Congress and the President are facing during these next several months and why these events are crucial to the nation and could have consequences for long-term post-acute care providers?
Well, what the government is facing is an enormous debt problem. We have now $16 trillion in debt, which is obviously a record. As it relates to our gross domestic product, it's pretty much tied for the highest amount of debt we've ever had. We have had debt this badly before, right after World War II, but we were able to work our way out of it. So the challenge that the President and Congress face has to do with how do we get out of this very bad debt situation? How do we get out of it at a time when our economy hasn't completely recovered? So if we try to get out simply by cutting, we can make things worse for our economy. And how do we get out of it when no one's getting along on the Hill? So it's a big, big problem for the policymakers. As it impacts us and our members and all the folks that we're trying to take care of, it also is a very big deal. And that's because over 80% of our funding is from Medicare and Medicaid. And when Congress is talking about cuts, they're talking about us. And so what we have to do is navigate our way through this, and as they go through all these different crisis points that they've set up, try to do the best job that we can to make sure that our residents and the people that we're trying to take care of don't get cut in the process.
So what can providers do at the grassroots level to improve the outcome of these events?
Well, there's a lot that our providers can do. I think every trade association in town has active members and some political activity, and they can make some noise. But the secret weapon that we have is that we have members all over the country. We have buildings in every congressional district, obviously in every U.S. Senate seat in the country, and we have hundreds of thousands of folks that work in our buildings, really millions that work in our buildings that can help us out. So the way that our members can help us is through our Grassroots program. If you go to our website, you can see how to sign up for our Grassroots advocacy program. We have over 100,000 people signed up. It allows us to send tens of thousands of emails to the Hill when we need to. So the first thing I would say to our members is sign up for our Grassroots advocacy efforts. And then finally, if you can get your member of Congress or your state rep or your state senator to come through your building to see the great work that you're doing in your buildings, that helps a lot.
So where do you think Congress is headed on the budget debate, and how do you think it will impact providers?
Well, I think Congress is headed for continued big ideas but little results. So I'm very concerned that as we come up on March 1, when the delay in sequestration is set to expire, I'm concerned that it will expire. And if it does expire, then our members will have a 2% cut to their provider rates on the Medicare side. The next sort of crisis point then is on March 27th, where Congress needs to pass a continuing resolution to keep government going. And once again, they'll be looking to cut programs as sort of the ransom for allowing the government to continue on. And we've got to avoid being a pay-for in that process. And then the debt ceiling has been delayed, but it will expire on May the 19th. And again, talk about big cuts potentially to us will come about in the process. So at every step of the way, March 1, March 27th, May 19th, we've got to be providing solutions to Capitol Hill to find ways to solve their budget problems without hurting our residents.
What are you and your board members at the American Healthcare Association doing to prevent further cuts to Medicare and Medicaid?
Well, our mission statement is to improve lives by delivering solutions for quality care. And our strong feeling is that the way that we make it through this, and not just survive, but to prosper, is that we need to do two things. First, the sector in general has to be the cost and the quality solution as far as taking care of people at the end of their lives. And secondly, we've got to be a political powerhouse. So on the first point, being the cost and quality solution, I really feel like AHCA is leading the way in moving our quality initiative and materially improving the lives of the residents in our members' facilities. But ultimately, it's up to the members, and the members are delivering. They are implementing programs to reduce rehospitalizations and improve resident satisfaction and decrease staff turnover and decrease the use of antipsychotic drugs. And I would just encourage folks watching this to continue your efforts in those 4 areas. It not only allows us to reach our goals, but facilities that succeed in those 4 areas are really going to succeed in the future. They're going to get more post-acute admissions in the future. So the first thing that we're doing is continuing to move our quality initiative. The second thing that the board is doing is it's really challenging us to come up with alternative ways that Congress can save money without hurting nursing homes. So we've come up with Medicaid reforms and Medicare reform ideas that we're taking up to the Hill. So we're not just another trade association saying don't cut us. Yes, we're saying don't cut us, but we're also saying here's a smarter way to move forward, and that's what we're working on.
So last month in President Obama's second inauguration speech,
Right.
he alluded to a renewed commitment to Medicare, Medicaid, and Social Security. What do you think of his statement with regard to providers?
Well, I think it's extremely important that we affirm our commitment to our safety net in the United States. Yes, we are a capitalist society, and that's extremely important, and it's important that we don't become a socialist society where it's not possible to succeed in a generation or two. But at the same time, we need to have a safety net. And historically, we have had a strong safety net as it has related to our older population generally and to long-term care specifically. And I think it would be a mistake and it would be shameful if we let that commitment drop and had a whole generation of older people that just couldn't receive the type of care that they deserve. So as Congress goes through this very tough and challenging debate, and it's not easy, I get that, I just hope they remember that this truly is the greatest generation, and we truly do have an obligation to do everything that we can for them.
Okay, one more question.
Okay.
Do you think that Obama's statement was politically, do you think he was sending a message that he's not going to move on any of those, on these issues?
I think that since the election, Democrats feel very emboldened that there shouldn't be many, if any, cuts at all to Medicare and Medicaid. They really view the election as a statement from the American public that the direction that they have been headed on entitlement programs should not change. On the other hand, Republicans won the House, and the Republicans feel like they have a mandate from the folks that put them in office to cut spending.